Well, just diving right in, 15 years ago, I was on a quest to basically try to figure out and understand what was going on with healthcare, because a close friend of mine, a system failure, basically killed her. And that's obviously a rough situation, but I was lucky enough to meet Garrison Bliss and learn about DPC. And I saw it and I was like, that's the future we need to have. And so pretty cool to see how far it's come. And in that process, I was the first national writer to write about DPC, wrote the seminal paper on DPC. I think that was probably 12 years ago. And so even though I don't have a dog in the fight directly, as was mentioned, I'm a big advocate. And so it's a real honor to be back here. It's amazing to see the growth of the community around DPC. You all that are on this journey, you've taken the high road. And it's not necessarily the easiest path, but it's literally restoring hope and the American dream. And increasingly, doctors are realizing that if they don't understand and impact the health plan, a lot of their good work is going to be lost. And so I want to talk a little bit about what that means, what the opportunity is, through a story of a DPC-fueled American comeback story in Northeast Ohio, a very sort of stereotypical Rust Belt community. And you look at the challenges they have, they're significant. And the way I would frame it is America's #1 comorbidity with 138 million people is the old healthcare economy, status quo health plans. They're fueling financial toxicity at an amazing level. 40% of adults, this is over 100 million Americans, are in medical debt. And that's causing people to avoid care, which is the #4 cause of death. There's very treatable things that, understandably, if touching the healthcare system means financial ruin, people don't want to inflict that on their family. So consequently, it's becoming a leading cause of death. West Health did a study a couple years ago, just the cost of medications just for Medicare recipients was going to be about 100,000 deaths a year. So we have a real problem with that. And if you look at what's going on in Ashtabula, again, a very challenged community, a third of the kids growing up in homes with poverty, over 60% with free and reduced lunch. So this was not an easy setting to go into. And it was a medical desert, less than 30% per capita docs in this community. Certainly wasn't helping the health outcomes there. But the story really begins with a benefits broker who saw the light, learned about our movement. I guess he was told to watch my TED Talk by some TPA, and he created a community-owned health plan. And if you look at the health outcomes of doing the things that are a part of this blueprint that people like Bryce Heinbach are following, if you could put those health outcomes and put it into a pill bottle, it would be the blockbuster drug of the century. Nothing would come close to that. That's the kind of impact. But it shows that you can start very small. He started with a single employer, 38 lives, and cut his teeth because he'd been a status quo guy. It was miserable. He was financially successful, but he was going to leave the profession if there wasn't something better. And so joined our program. We gave him training, tools, and then he started doing a direct contract with an independent DPC. And initially what he did was he pulled the doc out of retirement that had been burnt out working for a large system in that area. And then, but that was kind of a temporary solution. And then he went to the DPC mapper and looked up where was the closest existing DPC practice. It was about 45 minutes away in a suburb of Cleveland. And he said, "Hey, doc, I've got 400 lives. If you will come up here, we'll give those to you." Doc said, "Sure, I'll come up 2 or 3 days a week." And so that continued that journey. And then He called up the community pharmacist. And if you know anything about what's happening to independent community pharmacists, like as bad as it is for docs and many of us, like I don't even know how it's possibly legal what's happened to independent docs, and well, them too, but independent community pharmacists. He called up Maria Fowler and said, this call is going to change your life. And he's not one for hyperbole, but she said it absolutely has. They became the preferred pharmacy for that. Fast forward today, from this very modest start with a private sector employer, then it went to some public sector, school district, which I'll talk about in a minute, and then the county, and then the city of Ashtabula, and really fuels word of mouth. It's pretty remarkable what's happening. And I don't have to tell this audience the benefits of DPC, but I'll just highlight a couple unique wrinkles to that. I mentioned the pharmacy and the independent community pharmacy. They're the preferred pharmacy. You go there, you're not paying anything for meds for the members. That's a game changer. That's like, for these teachers, they're like, you know, and that's the most common touch point for most Americans. It was like getting a big raise, you know, because some of these medications with cost sharing can be significant. The other thing they've done exceptionally well is they have, in our blueprint, we call it individual stewardship. There's different names. They call it concierge nurse navigators. But let's face it, when you enter the healthcare system, you know, it's like, you know, you have a complicated thing. This is, you know, as dangerous as climbing Mount Everest. You wouldn't do that without a Sherpa, and certainly having a navigator to help with the clinical and financial challenges is very significant, and I think is certainly a part of their secret sauce. So it's had an amazing impact, but of course it's not just primary care. If you look at what happened, it was a single hospital town owned by a very large system, one that is world-class in a particular specialty, but they charge like they're world-class in everything else. And candidly, I wouldn't send my worst enemy to some of their hospitals for the rate of complications and, you know, things like hospital-acquired infections and repeat surgeries for like musculoskeletal procedures, and they're still charging unbelievable rates. So for a while, they said to the, you know, they didn't take away access to that, but they said to the members, hey, if you go to the #1 surgery center in the state, you're gonna have to drive an hour, but you're gonna pay $0. And they got so much business at that surgery center that they opened up a clinic. Again, helping to improve that medical desert situation and improving access. And, you know, that multi-specialty clinic and surgery center is incredibly excited because, you know, these type of plans can solve issues for provider organizations as well. I mean, that's where I started my career, and what's today the, you know, euphemism revenue cycle. You know, I was working in hospitals helping them with their billing, and it can be very difficult to get paid. And so when you pay timely, you waive all cost sharing for members, and things like that, it becomes very appealing for these organizations. So that's a big part of it. Now, if you look at the economic impact for the community, people don't tend to think about healthcare when they think about shop local. They think about food and retail, but let's face it, what's more local than an encounter with a doc, a nurse, a pharmacist? Yet in most communities, as little as a third, as much as 2/3 of our dollars get extracted out of local economies. And if you know anything about localism and that, you know, you just don't have, you're missing out on this multiplier effect. The local school was pretty incredible. This is the 8th poorest school district in the state and the 8th poorest county. And despite that, they would generally pass school levies. But unfortunately, May 2021, school levy failed. Normally, that would have been a disaster. Cut teachers, programs, transportation, benefits. Even though the plan they'd put in, this community-owned health plan, had only been in place since July of 2020, they'd already saved more money than the entire school levy. You can imagine what that did for word of mouth. So that's been a huge benefit for that community. If you look at people are actually getting real raises. They got kind of faux raises before where, yes, you'd have more in your paycheck, but every dollar and then some would get eaten away by the premium increases and all the cost sharing and these absurdly high deductibles that are causing tens of millions of people to be functionally uninsured. You know, their life savings are less than their cost sharing. And what's cool in this, what I call a new healthcare economy, which is already bigger than the US video game industry or textile industry, it's very common for the all-in cost of medications, lab, imaging, even surgeries to be less than the cost-sharing component. And these dollars are recycling in that community, and it's better than any tax break a community could ever come up with because it's this huge raise and huge infusion. You know, in my TED talk I gave, I said if every employer did what Rosen Hotels did down in Florida, it would be like a recurring $500 billion economic stimulus from the least productive industry in America. Like, what is the least productive person in our economy? You know, somebody in a clinic or a hospital. And, you know, there's been studies where in JAMA, like the healthcare industry hasn't seen a productivity gain in 2 or 3 decades. And there's much higher productivity industry, so it's a much better use of the dollars. And then if you look at it from a competitive advantage standpoint for the employers, they're now able to add dependent coverage back in. That used to be kind of almost a given, and that got stripped away from plans as, you know, the so-called solution to ever rising premiums was just rip away benefits. You know, every year open enrollment means pay more, get less. They're reversing that. Absenteeism has plummeted because they can get access. You know, the DPC doc talked about this patient he took over. He worked for the city, but he's also a coach. He got a cut, and he could not get in to a primary care in the old system. He goes into a hospital, infection, hospitalization, a nightmare. He gets out, lots of dollars, and he couldn't get into the primary care doc. He finally just walked in. It was like a very easy thing to treat for the DPC doc, and then he just, would get daily secure text messages with pictures and all good. Like, these really simple things just go haywire in the other system. So it's really just amazing what's happening. Certainly fully paying for DPC memberships, no cost sharing when people take the smart path, and generally, the plan design, I'd summarize it as make good decisions free. Like, why on earth would you ever put barriers in front of things that work, like primary care and physical therapy, and then have it an unlimited corporate credit card for these super high cost things? It just makes no sense. And, people have just gotten smart on that. And what we're seeing here in this setting, obviously this event, and we're seeing throughout the Health Rosetta ecosystem, is tremendous growth. And we have several docs. Some have been on stage, like Emily and Jonathan. Brandon have actually joined the Health Rosetta Advisor Program because, no offense to my broker friends, but it's a little harder to become a doctor than a broker. And they were getting tired of getting cut off at the knees. Like, they'd convince some employer we should do this, and then the employer would go back and they talk to their broker, and the broker's conflicted, like, oh no, that's a terrible idea. And they're like, screw that, we don't want that to happen. Furthermore, to my earlier point, with these old line health plans being America's #1 comorbidity, you can't really do great population health without understanding these things. Kenneth talked earlier about this idea of a fellowship. He talked about care coordination and transparency. Those are two important things. There's others that's why we have a bunch of docs that have said, we're just gonna join this program. It's sort of we haven't made it an official fellowship, but we're talking about that. That seems like a wise idea. And just the difference is very significant from just a couple years ago, where it used to be like DPC just bolted onto the side of the status quo plan. Definitely better than nothing. But instead, what you have now with community-owned health plans like the one in Bryce, or I saw Decent was here, they're building around DPC. That's very different. And we could go into that if we had more time. And Ashtabula is inspiring a lot of other communities, so these things are replicating. And really one way of looking at community-owned health plans is it gives the ability for these world-class health plans to replicate much faster. There have been some great plans done by brokers on a one-off basis, but they just kind of would happen so slowly, and it was so difficult that it became, after doing 3 or 5, death by 1,000 paper cuts. It was just something that would never scale. It would be this interesting story on the side, but now we have a way where we're seeing, as you saw with Bryce, he was actually the first doing this community-owned health plan, and he's already at 5,000, whereas others are able to get there much faster. And so that's the sort of thing that we teach people on how to do and equip and enable them. And you can see the health transformation, health outcomes has improved significantly. And this quote, I think, really captures it well. You know, employers want what is already working with other local employers. They want similar ingredients and as soon as possible. They just want to mirror what our clients locally are doing because they know it's working. And any incumbent industry uses fear, uncertainty, and doubt to freeze status quo. That stops working when you can see it with your own eyes. You know, the city manager, he's the spouse of a teacher, and so he was a beneficiary of a great health plan, and then he was like, of course he's going to make it available to the city. And word of mouth is clearly the most powerful marketing there is. And so what I'd invite you to do is, you know, I've got my latest book is Relocalizing Health. The Future of Healthcare is Local, Open, and Independent. You can get a free download. You go to our site, just go to healthrosetta.org/relocalizing. If you're interested in exploring this idea of kind of this, you know, right now in air quotes fellowship, but you know, we're looking at formalizing that, like a bunch of docs have done, as well as some other clinicians. We have some PTs and some chiropractors. I've got my email, it's easy to remember, just dave@healthrosetta.org. And if you're not ready to do those things, that's fine. Just work with a Health Rosetta advisor. More and more of them are getting equipped and really understand. It's been an education process with them to do this. So you just go to healthrosetta.org/map. And so those are a few resources. Somebody happily, but coincidentally, they shortened Health Rosetta, not to HR, because that was kind of confusing because of human resources, to this hero. And I was like, oh, that's cool. And if you know anything about the hero's journey, it really is the hero's journey, right? This is the famous, you know, sort of story narrative that, you know, Lord of the Rings, Star Wars do that. So incredibly grateful to be invited back. Grateful for all of you doing what you're doing. As was mentioned earlier, it's not necessarily the easy thing. You get plenty of pushback, but I'm sure you see the life-changing impact on your members. So thanks again, and appreciate the opportunity.